Houghton here from Houghton Physical Therapy, and I'm psyched to be here today. So for those of you who have not tuned in, my name is Todd Houghton from Houghton Physical Therapy here in Attleboro, Massachusetts, and I am passionate about helping people. I am passionate about helping people with their physical therapy needs, and especially their mindset to help them reach their goals. The purpose that I started doing the Facebook Live video was to try and have a bigger reach, to share with more people that I'm able to treat on a daily basis, and more people that we're able to treat here in the clinic. So I wanted to do the Facebook Live video just for over my 24 years of experience. How can I add more value to you? So on a weekly basis, I come up with different topics. I talk with different patients, and I'm excited about today. For those of you who have already tuned in before, welcome back. Really excited you're here again for another session. Please feel free at any time to reach out at toddh@houghtonphysicaltherapy.com if you have any questions or any comments you want to add in. At the end of the video, I take some questions, so I'd be more than happy to answer your questions right online if you would like. So one of my favorite topics, not just because I enjoy working out and I'm a triathlete, but it's a topic of mine that I see on such a regular basis that gets completely misdiagnosed and completely mistreated. So I want to share through my eyes what I think is some beneficial way to help with the treatment of shin splints, hot topic of the week. Through my eyes, shin splints, if you've watched a few of my videos like anything else, is a result of something else. Especially with anything in the low body, I'm going to say that the shin splints are a problem higher up the chain. So we're going to start right at the top of the chain, which is going to be your spine, specifically your low back. So it's my belief that the shin splints are a result of that. So I want to go over a few things. One of the there's three things that nerves do. The first one is a pain response. So you can get pain in your shin, you can get pain down your leg and your lower leg, so it can affect the pain. The second thing that nerves do is they can affect sensation. You can get numbness or tingling. The third thing that, and which is the biggest thing, is they can cause weakness in your lower leg, which to me is the biggest problem for shin splints, affecting the juice. So I also know that the lower body is innervated by a few of the lumbar vertebrae, L4, L5, and the first sacral vertebrae. And I know by addressing these areas particularly that we're going to notice a big change in everything in the lower body, as the body is in an engineering structure as well as an electrical structure. I'm going to say that over my years of treating patients, less than 5% of people that I actually had true shin splints. And I really believe in working on the fuse box theory, which means that the fuse box is responsible for powering all the juice to the plugs. And what that means is your low back and your spine is responsible for innervating and sending juice to your hips, your knees, and your ankle. So I'm going to go over some general anatomy for you for the lower body. So I have my trusty lower leg model over here. So we have the anterior tibialis. So we have, just to orient you, this is the tibia, which is the shin bone, okay? And the fibula is the one on the side over here. So that's the fibula, this is the tibia. This is your kneecap, the round bone over here, right, your kneecap. And then we have your foot right up over here, okay? Many bones in the foot, as you can see. And the calcaneus, which is the heel in the back. So we have the shin muscle, which is the anterior tibialis muscle, which comes over here in the front of your shin. And then we also have, and what that's responsible is picking up your foot as one of the motions, and it also kind of turns in your foot a little bit as well. So then we have the posterior tibialis muscle, okay? We have the gastroc and the soleus, which are the two muscles in the back of the leg, which is the calf. And then we have the peroneal muscles, which run right down the side of the ankle. So why is all this important? So what exactly is shin splints? What exactly are shin splints? Well, we're going to break it into two different types of shin splints. We're going to have the anterior, so I'm going to show you with my leg right here. We're going to have the anterior, which is the outside of the muscle up over here, the anterior tibialis. That would be the one in the front of the compartment. And then we're going to have the medial shin splint, which is which is medial to the tibia, so on the inside of the shin. And usually the shin splints are usually about the middle third of your whole shin. And those are some other muscles that are involved. But to me, it's always going to be a problem of the juice to the muscles, the juice not getting to the muscles enough. So they redline them, they overwork them. That's why they fatigue. And then you have different issues. So exactly what is shin splint? Well, shin splint is when the muscles or tendons in the lower body or the bone tissue become overworked. And in my opinion, they become overworked because there's not enough juice to the muscles to work. I'm going to go over a few different other reasons too. I'm going to say that there are 3 reasons why the lower body can become overworked besides not having enough juice from your fuse box. The first thing is going to be your footwear. Your footwear could be too old. If it's more than 4 months old or 400 to 500 miles, then that's be something you want to change out because that can change the mechanics of your foot and you're going to lose the shock absorption. The other thing is the footwear could just be too heavy for you. Depending on what you use, if you're stepping up, if you were running in a lighter shoe, you step up to something heavy, just that change in the weight is going to make the lower body work that much harder, which can be a cause of your symptoms. The footwear, believe it or not, can be too tight or too loose. Since I race triathlons, I have the quick shoe laces that I just kind of cinch time. If you kind of, it's kind of like an elastic type material. You pull them up like a cinch, and it kind of locks them in, but then it lets your foot seek where it wants to be. So it's easier to loosen up or easier to tighten up. So footwear being too tight, footwear being too loose, it can cause pistoning in your shoe, which is not good. The next thing is too steep of an increase in volume. If you started running or started walking or started hiking, you've increased your activity level too much, another piece. And just not enough rest. Overtraining is a huge issue, especially with these injuries. So making sure that you're getting enough proper rest. 2 of the common issues that can cause running issues that can cause shin splints. If you're running on the same side of the road, like, if you're running down a road and the camber of the road drops off of the pitch of the water and the snow, the water is supposed to roll off the road. If you run on the same side of the road all the time, that can be something that could cause an issue from running. And also the same thing could be if you're running around the track, if you run around the same way on the track and you're always pivoting off the same foot all the time, something to think about that you want to maybe run every other time you're running at the track to run the opposite way. 3 reasons that the lower body can break down. And this is the biggest thing out of the whole talk tonight. The most important thing to me is that someone either doesn't have enough abdominal or core low back strengthening. They don't have enough strength in the core or the low back, meaning that they don't have a good core low back strengthening program. If you are working on a program, if you're still having those issues, it's because you might have incorrect form with the current program that you have. Another big piece that I'm noticing, especially over the last 3 to 6 months that I've been talking a lot about on these Facebook Live videos, is find out your starting point. There are many exercises that we can give you, but if they're given to you in the wrong order, in the wrong sequence, or at the wrong point in your rehab or in the wrong point in your strengthening program, it's just wrong and you're going to hurt yourself. So what are the symptoms of shin splints? Well, someone might have pain in their calf, someone might have pain in their shin, someone might have pain on the side of their leg, someone might have pain on the outside or the inside of their leg. They also might feel like there's cramping when they're walking. But it's usually right in the front of the shin where people get most of the discomfort. So that's why they're called shin splints. Someone might also complain when they touch the inside of their shin or the outside of their shin bone that it's going to be really uncomfortable to the touch. So me as a physical therapist, what am I going to see? Subjectively, when patients come in, again, they're going to tell me that they're complaining of inside or outside of the shin pain. They're going to have pain with walking or running or hiking, pain with a certain pair of footwear, pain with a boot. There's many different complaints that they might have. So objectively, what might I see as a physical therapist? So I'm going to notice that they have significant tenderness to either the outside of the shin bone or the inside of the shin bone, usually along the middle third. I'm also going to notice that they have significant weakness in their glute maximus and weakness in their glute medius, which is on the side of the hip, just to go back and remember. So we have the glute maximus, which is your butt muscle, right? And then we have the glute medius, which is a muscle on the side. The glute medius muscle, as we're walking, it stabilizes your hips and your pelvis and stops your hip from dropping in. When this muscle gets overworked and the glute muscle isn't working, we get your knee to cave in, we get your foot to turn in, and then everything else happens right down the chain. So I'm going to notice a weak glute max muscle. I'm going to notice a weak glute medius muscle, a glute medius muscle that's in spasm, low back that's going to be weak, and I'm likely that the SI joint or part of the low back is also going to be not moving well. I might also notice a torsion in the hips of the pelvis, and I'm definitely going to notice with all these patients that there's going to be a weakness with how your foot, dorsiflexion, which is when you bring your foot up. I'm going to notice when someone brings their foot up, I'm going to notice a weakness in dorsiflexion. I'm also going to notice a weakness in their great toe, which again is going to give me signs going right back to the low back. I'm also going to notice that their upper back, the thoracic spine is limited, the low back, the lumbar spine is limited. And I'm also going to see that there's going to be soreness probably on the same side of the back as they're noticing the shin splint issue. A special test that someone might have, the doctor might send you for an x-ray to rule out a stress fracture, which if you have shin splints that go on for so long, it's likely that you're going to get a stress fracture. So who typically gets this? It's usually runners. It's usually people who are very active. People who have improper training methods, they either run every day or they don't take enough time off in between. But the biggest thing I see, the biggest thing is they don't do strength training. And if they do, they're not doing it correctly. If someone has a great strength training program, a great core strengthening program, it's unlikely that I'm going to see them too long in a clinic. Now I'm going to go over, this is kind of the fun part for me. So I'm going to go over a couple treatments that I see that are the typical treatments that do not work. They just do not work. And that's one of the reasons that I want to do this and just share some of my knowledge, because there are some things that drive me crazy. The first thing is rest. Who's going to rest? Who has time to rest? Rest rarely, if ever, works, unless you have a fracture. I'll say if you have a stress fracture, that's a different story. So rest, it's not really proven to do anything. You're going to get deconditioned. So you really want to, as much as we can, we might have to vary some of your workouts. You might have to vary the activities that you do, but really rest is never the answer. Another thing that really works is heel inserts or orthotics. Because why? They're not treating the problem. They're treating a symptom of another issue. Address the core, address the glutes, address the glute medius, super important. So again, you can spend money on them, but it's really going to be a waste of time. Night splints. I don't know about you, but I don't want my foot strapped up in a night splint, but I know that it's just really uncomfortable. And let's go and treat the cause of the problem, which a lot of times is, again, what? The low back, the glutes not working, and the glute medius in spasm. How's it going, Larry? And the other thing, again, cortisone shot in surgery? No. Let's work on the cause. So what I'm going to go over tonight in terms of some of the treatment a little bit later on is things that are not flashy. I'm going to go over things that are so simple, but they're not easy to find time to complete. And if we do those, we're going to get a really good base. We're going to get a really good core strength, core base, and the body's going to function a lot better. Now, here are some other here are some things that we'd be going in the right direction. So those are some crazy things that I don't believe, in my opinion, really work. Now I'm going to go some things that are definitely in the right direction. If you want to go get a massage is always good for this, as well as it's good for the physical body. Massage to the low back, to the glutes, really work out the legs. Great idea. Get the blood flowing in there. Love it. Grafton and dry needling to the low back and the hips and the glutes. Again, great choices. Now these are really the money moves that I feel are the most important things that are going to move you in the right direction. Education. So when I have a patient come in and they have shin splints, I'm going to tell them what I'm doing, why I'm doing it, and how. So education, so they can kind of be on board and then do some research on their own. Next thing is find your starting point. Where is your core strength? What is it at? Where do we need to start you at? And then we'll take it from there. Educating you about the fuse box, explain the how, the why, and the when about the nerves. What do they do? Again, pain response, sensation and juice to the muscles to work. Huge. And then explain to them, if your low back isn't working as well as it should, you're making all the little muscles all the way down in your legs redline all the time, which is going to, after time when you redline something, it's just not going to work well. So for me as a physical therapist, how am I going to treat shin splints? You're not going to believe this, but the first thing I'm going to start off with is I'm going to go to their mid-back and I'm going to mobilize their mid-back. Because I know if their mid-back is a mobile piece and if the mid-back is moving, they're not going to have to hyperextend their back, which again is what? Going to shut off the fuse box, which is going to what? It's going to cause weakness, pain, or numbness all the way down into the leg. So I'm going to work their upper back. Then I'm going to work their lumbar spine. Then I'm going to teach them how to activate the glutes. I'm going to teach them through some glute squeeze, through some single leg hip extension, through some Supermans, through some clamshells. I'm going to activate the abdominal muscles in the front, the transverse abdominis, many of the other muscles, and I'm going to do a trigger point release to the glute medius. That's where I'm going to start. And depending on where they are is going to depend on how quickly I can advance them. Now, am I going to advance them and give them too many exercises at the beginning? Why would I do that? I need to make sure they're at the right point at every part in their rehab. And it's my feeling, if this is done in this order and correctly like this, we're going to get enough juice to the muscles to work. And when they're not functioning at 10 to 20 to 30%, they're functioning at 100%, they're going to work better, and the shin splint should just melt away. Hopefully that was helpful. So I have some questions that a few people emailed in. The first question is, I really enjoy running trails in the forest near my house. After I run for about 30 or 40 minutes, I realize that I start tripping on roots and rocks. I've run these trails so many times, what am I doing wrong? Great idea, great question. It goes back to, again, the fuse box theory. If your lumbar spine, the low back, specifically the fourth lumbar vertebrae, is sending enough juice to the muscles to make your shin work, it's going to be able to pull your foot up so you can clear those roots, so you can clear those rocks. And when you're low back, if you're arching your back or you shut off the fuse box or you shut off the muscles, the muscle fatigues out and you can't clear it, and then you're going to trip. So I would say we need to look at your core. We need to find a good starting point for your core. Then we need to talk about how do we engage your core throughout your run. How do we engage your core, whether you're running up a hill or down a hill? Because there's definitely things that we can do to help turn on the lumbar spine as you're running, because you don't want to turn it off because you'll get a foot drop and you'll start tripping. So that's where I would look first. I wouldn't be looking at your footwear. I wouldn't be worried about anything else. If we address your core, figure that out, address your lumbar spine, see where the weakness is, should make a big change. I'm getting a bit of knee pain randomly. Are the two connected? So when someone says they're a pronator, someone says they're a supinator, to me, it's all about the core and activating the core when you run. I don't really tend to look at someone's, whether they're supinator or pronator. I would recommend them to go to, a good running store, many good local running stores, to have someone assess their foot and see what shoe that they need to be in. That's not my specialty. But then from that point, for me as a physical therapist, I need to talk to them how to engage the core when they run, how to engage their glutes, how to engage their abs, how to have a good posture as you're running so we're not turning stuff off. We want everything turned on. We want all the muscles turned on. So if you're not having enough juice all the way down the muscles to work, if we're not having enough juice, then over time, what's happened, we're not going to have enough support in the ankle's going to give out, which is going to increase your likelihood of spraining your ankle. I can also bet if I was to go to your lumbar spine around L4, L5, and if I did some mobilization at your spine, I could probably take away a lot of the ankle pain, and you would notice your strength come back immediately. So that's where I'd start. I'd start at the low back and then work our way down the chain. There's a question from Bob Milne. Thanks for the question, Bob. How about compression sleeves on your calves? I used to always wear compression sleeves on my calves all the time. I really felt it was a big benefit. I like compression sleeves, just in my opinion, for recovery. Because if you just did a long race, like I just know you did an awesome job on a half Ironman, that your body is going to struggle because your body is going to be swollen, the joints are going to be swollen. So I think the compression calf sleeves are good to help get rid of some of the swelling. It's going to really aid in your recovery. I actually like doing compression socks, and I have a pair of compression pants that I wear to really help with the recovery. I think the compression sleeves are kind of treating the symptom. If you're using it to get through a run or to get through a bike, I think it's kind of treating the symptom. If you're sore, it can be good to provide a little bit of compression or warmth when you're running, keep the joints moving, keep the muscles moving. But I see more of a benefit for recovery instead of during the actual activity. Awesome question. And if you have any questions, obviously you can reach out to me at any time. Next question. My knees bother me when I run on cement, but not on the pavement. They are both hard surfaces. What is the difference? That's a really good question. I actually found this out from Shelley when she told me that she really noticed a difference, that she couldn't really run on cement. And I thought to myself, well, that I couldn't understand why. So then after doing a little bit of research, that cement is just, it's a lot more dense. So there's not really much give, where you're going to get given some pavement. So that's my understanding, that running on that is better. Obviously, pavement is better, but running on the trails is even better. Great question. The next question, I am training for my first half marathon. How do I stay injury-free during my training? Well, so far from giving my talk tonight, the biggest thing that I find for staying injury-free is a strength training program. You got to do it. You have to do it 3 to 5 days a week, no questions, if you really want to be injury-free. So you don't have to come see me. I'd rather not see you. That's why I'm doing these talks. So I would say a good strength training program, but you need to find your starting point. Where's your starting point? So go to a professional that's going to help you find out where your core imbalance is. For example, planks are great exercises, but hardly anybody can really do them properly. Or there's really no reason to hold it more than 30 seconds or a minute. I don't see why people hold it longer than that. But again, so holding a plank is a great exercise, but maybe it's not right for you at this point. We just need to learn how to activate your core, and we need to find your starting point. So once you find your starting point, to come up with a great upper and lower body strengthening program, crucial to your success. I have arch pain, and I've tried many different pairs of running sneakers and orthotics, and I have not found a pair that works for me. Am I doing something wrong? What can you suggest? So through my eyes, I would say that I would be going to address your low back. I would go address your low back. I would see if your glutes are firing. I would guess that depending on what side your arch pain is, I bet you have low back pain on that same side as well. You might not have, it might be general low back pain across the low back, or it could be specifically right on your spine on that same side of your spine as the plantar fascia. So I would suggest first taking a look at the cause, which is always the cause. Always the cause of any lower body injury is the low back, is the glutes, is the glute medius. For every injury, that should be the starting point all the time, 100% of the time, no questions asked. So I would say I would start there. And I think you're going to notice really a difference. And I think you could probably toss your orthotics and make sure I would go to a running store, find someone that's really knowledgeable about what sneakers you're going to need, what your activity level is. We have really knowledgeable people in the area, and I'm sure you do anywhere, whoever's watching this video. So that's where I would start with your low back, and then I'd go somewhere and make sure you get some good sneakers by a professional. That's all the questions we have for tonight. Hopefully this was helpful to all of you. Please feel free to reach out to me at toddh@thoughtonphysicaltherapy.com. And I'm excited to tune in next week for another awesome topic. Again, Shin Splints, one of my favorite topics, core strengthening program. Hit some weights. Thank you very much. Have a good night.